Knock, knock, knock. Hello, Mrs. Gee. I'm Molly. I'm going to be the nurse taking care of you today. I am going to look in my computer real quick, and we'll get you started. I'm here to do an EKG, a 12-lead EKG on you today. You probably had one when you first came in, but we're doing another one today. So I'm just going to check the MAR. And Miss Gee, can you tell me your full name and date of birth for me, please? Ava Gee, good. 2/24/1960, 2/24/1960, good. And then I'm just going to check the medical record number, 1000 1000 1955 1955 4848. Wonderful. And then I'm just going to check the provider's orders to make sure. Obtain a stat 12-lead EKG. Perfect. Okay, so the first thing I would do is pull the curtain for privacy. I would raise the bed up to a working height for myself as well as the table beside me. Mrs. Gee, I'm going to lay you back so you're nice and flat, and I'm going to expose your chest and put a total of 10 stickers on your chest, and then we'll take a picture of your heart rhythm, and then that'll essentially be the entire procedure. Is that okay? Wonderful. So I'll lay you back. I'll take the dressing down. I've already closed the curtain for privacy. I'm going to hand hygiene once again. And I have my EKG machine in here as well as my wires and all of my stickers. So all of my stickers will be placed towards the heart, so like the little tabs that they connect to. So starting with V1. V1 will go on the fourth intercostal space of the right sternal border. So 1, 2, 3, 1, 2, 3, 4, right there. And then V2 will go on the fourth intercostal space left sternal border. So 1, 2, 3, 4, right there. And then I will skip to V4 first. And that one will go on the fifth intercostal space, mid-clavicular line. So 1, 2, 3, 4, 5, mid-clavicular line, right there. And then V3 will go in between V2 and V4. So right about there. And then I will place V5. V5 will go on the fifth intercostal space, left anterior axillary line. So 1, 2, 3, 4, 5, anterior axillary line. And then V6 will go on the fifth intercostal space, mid axillary line. So 1, 2, 3, 4, 5, mid axillary line, right about there. And then I will place my 4 limb leads. First, my upper extremity, so the right upper limb lead. Again, having the sticker point down towards the heart, and then the same thing on the left side, making sure that they're symmetrical. And then the same on the lower limbs, the right side, and then symmetrically on the left side. So Miss Gee, you can breathe normally. I'm just gonna have you stay very, very still. I have my EKG machine. Now I'm going to attach my electrodes to the wires. So I will do the right upper extremity, and then the left upper extremity, and then I'll do the right lower extremity, and then the left lower extremity, and then I will attach V1, V2, V3, V4, V5, and V6 And when I'm placing all of the stickers, I make sure to check the skin around them, that the skin is dry, that there's no redness or erythema noted, that if there's any hair, I would be sure to shave it. If there's any lotion or oils or anything like that, I would be sure to clean it prior to putting the stickers on the EKG. So all of my wires are now attached. Miski, you can breathe normally, just stay very, very still, and I will start the EKG. Good. I'm going to head and start watching the rhythms. Okay, Miski, you can relax. I have the rhythms in front of me, so I have just gonna check and see if there is any artifact, and everything looks great. So I'll be sure to give this to the provider so that they can go over and further assess what the further steps are. After this, I'm just going to take all of the stickers off like so. I would cover you back up, Miski. And if you would like the head of the bed raised, again, a pillow back underneath you, I would lower the bed to the fully lowered and locked position. I would put the handrail back up, make sure that your call light is within reach. I would ask you, do you need anything before I go? Do you have any questions about the procedure that we just completed? No? Wonderful. I'll be sure to go into your chart and document that we did a 12-lead EKG and that the results have been given to your provider for further inspection. And I would make sure I hand hygiene and be good to go.